The pharmacy of your choice scheme, beyond an enterprise resource planning solution. The pharmacy of your choice unit within the portfolio of the Ministry for Health is government's entity which provides efficiently and effectively free pharmaceutical and other services to an outpatients client base of over 151,000 patients, which is a third of the Maltese Islands population. The POYC unit, in collaboration with PTL Limited, developed a bespoke, innovative, real-time enterprise resource planning ICT solution spanning across 222 community pharmacies nationwide to manage and control these nationwide pharmaceutical services. The ICT solution supports the POYC unit's entitlement database, known as the backend, and the community pharmacy's web-based pharmaceutical dispensing screen, known as the frontend. All the movement and storage of pharmaceutical stock, work-in-progress inventory, and delivered goods travel seamlessly throughout the entire organizational supply chain, from the point of origin, that is the POYC, to the point of consumption, that is the community pharmacies, until the pharmaceutical stock is dispensed to the entitled patients. This ranks the POYC unit as the largest licensed pharmaceuticals wholesale distributor on the Maltese Island. The overreaching intent of this real-time ICT solution is to facilitate a more comfortable access to the government's free pharmaceutical service. This benefits all those patients who fall under government's policy or legislation, regulating the entitlement for free pharmaceutical treatment and services. The ICT solution facilitated the shifting of this service from the health center's pharmacies and moved it closer to the patient's place of residence, that is, to any pharmacy of the patient's own choice. Indeed, through this approach, the long waiting and queuing time spent at the NHS health centers and hospitals' pharmacies for this service has been eliminated, and simultaneously the patients received a prompt and more personalized holistic service. The benefits and the added value gained through the introduction of this ERP ICT solution are many. However, the key aspects are: firstly, the use of the innovative ICT solution allows the POYC unit to optimize its governance through the strengthening of accountability, transparency, and audit traceability throughout its supply and value chains. Secondly, it allows the POYC unit to continuously improve efficiency and effectiveness with regard to operational workflows and to take timely decisions preempting possible deficiencies. These include better stock management, reduced bureaucracy through alternative, more simplified and flexible operational processes, maximization of available resources with regard to human, financial and pharmaceutical stock, minimize human error, improved daily performance and productivity output. The solution itself is scalable and can cater for different needs. It allows for the integration of multiple schemes. For example, the National Celiac Scheme is also another initiative under the umbrella of the POYC unit that has been integrated into this ICT solution. This solution caters for over 1,328 celiac outpatients benefiting from the scheme through 54 retail outlets across Malta and Gozo, ranging from supermarkets, health food stores and pharmacies. The backend ICT solution of this scheme has been implemented and has replaced the past ration book system, which was limited in product choice and accessibility. The IT solution also allows the issuance of the patient's monetary vouchers, which are issued on a monthly basis in line with the patient's entitlement. The computer-generated prescription, launched in August 2016, is also another initiative that rests on this IT solution. This solution benefits the patients by providing a real-time electronic medical record, while the general practitioner has real-time visibility of the patient's latest pharmaceutical entitlement and can prescribe treatment from the pertinent list of medicinals related to the patient's medical condition. To date, over almost 100,000 prescriptions have been issued through the system within the NHS outpatients prescribing clinics. In the coming weeks, this web-based application will also be made available to doctors in the private sector. A first time for Malta, this ICT development is the platform for the introduction of the e-prescription, which development is earmarked for launch by January 2018. The launch of the POYC scheme membership card in January 2017 set off the process for the phasing out of the paper-based patient voucher letter. It is expected that within a year, all the 151,000 POYC scheme registered patients would have been transferred onto the card system. Equally important, it provides analytics, which can be used in multiple ways. The application of real-time ICT systems, together with business intelligence tools, are applied to timely identify and address operational performance inefficiencies, and thereby finding the best fit solution of how to continuously improve the overall operation. It also provides real-time performance data to audit stock management activities within the 222 POYC scheme community pharmacies. Through this IT solution, the POYC unit now houses the first electronic real-time outpatient data bank for the NHS and is able to provide statistical support throughout the National Health Service. Statistical support is also given to the National Statistics Office and the University of Malta with regard to health research-related programs such as demographic morbidity trends, management of treatment at patient level, facilitate gap analysis for the introduction of new treatment on the government pharmaceuticals formulary, analyze the cost of current and new drugs. The following screenshots have been selected to provide a cursory overview of the potential benefits arising from this bespoke ICT solution. This particular screenshot illustrates the reporting of logistics data with specific focus on the trend lines of the total unit volume and the value in euro of the pharmaceuticals transferred over the period under review. There is also a possibility to select various ways of how to show the information by value, units, pharmaceutical categories, pharmacies, etc. This screenshot illustrates how the solution identifies and addresses operational performance inefficiencies. It shows data related to, for example, out of stock, expired and damaged stock, undelivered items, etc. Having such reports at hand helps the timely identification of shortcomings and facilitates remedies. The ICT solution provides a collaborative tool that enables the most accurate pharmaceuticals requirements forecast possible. The forecasting solution updates itself on a real-time basis. These improvements include lowering inventories and production costs, improving on-time deliveries and client satisfaction, thus improving quality and eliminating errors. The following screenshots reflect the use of logistics and inventory management. All pharmacies are organized by region in accordance to a scheduled delivery date in order to enable an efficient service delivery. The POYC unit delivers to 43 pharmacies on a daily basis and covers the 222 pharmacies at least once weekly. This screenshot shows the order per pharmacy. Replenishment amount is calculated based on the allocated entitlement for the patients registered with the particular pharmacy. The top-up quantity is generated automatically. The system also caters for urgent and irregular orders. The screenshot shows the solution for the National Celiac Scheme. The system allows the monthly generation and issuance of patients' monetary vouchers in line with patients' entitlement. This screenshot shows patient-related information. It includes the entitlement of each pharmaceutical and the transaction history. Notice the transaction window showing the need of the pharmaceuticals for the next period as well as the stock balance. The system also caters for the returns of pharmaceuticals. In the case of unredeemed stock, the pharmacy can send the stock back into the supply chain. The final screenshot is dedicated to the inventory control at the pharmacy's level. The ICT solution allows the POYC unit to have real-time data on the stock and its movement across the entire community pharmaceutical network. The main intent is to further expand the visibility of the pharmacist's view through the WPDS screen and to give even greater empowerment over the stock management and control at pharmacy floor level, thereby simultaneously augmenting their direct responsibility and accountability. In closing, please allow me to underscore the fact that the POIC unit's ERP ICT solution, applied to the overall management and control of the POIC scheme, has not only enhanced the POIC's pivotal role within the public sector, but has unprecedentedly given the unit a distinctive identity in the pharmaceutical field, where dynamism and continuous excellence must remain at the forefront, guaranteeing a high-quality standard, patient-centric care service. Succinctly put, through the POIC scheme ERP ICT solution, it was possible to vindicate government's philosophy and our remit, that is, to save lives and to improve the health, both physical and mental well-being, of our national patient population, while balancing business and social objectives to ensure sustainability and greater economic opportunities. The 8 awards secured by the POIC unit in these last years, which include the prestigious Malta Best Healthcare Entrepreneur Award for 2016 and the Best Use of Technology in Business Transformation Award in 2017, are evidence enough of the substance of this presentation. Thank you for your attention.